Hey, Dr. Chris Goobles here from Square One Health, and we are doing our Live at 5 today. And today I want to talk about why adolescents and teenagers tend to develop or their scoliosis tends to progress during growth spurts. And so if you look at this, and this is also why we used to do screenings for scoliosis when we were in middle school and possibly even early on in high school. Most states do not have official scoliosis screening programs today. But when we think about scoliosis, a lot of people think about scoliosis in teenagers, and it's about 2 to 4% of adolescents or teenagers actually get diagnosed with scoliosis. But if we look at this graph over here, if you start over on the left, you see scoliosis does, first of all, it does not just gradually increase. You have specific times where the severity of scoliosis progresses much faster. So when we're looking at this slide, you can see there's a chart here that shows the progression of scoliosis. And you can see that on the left, or the y-axis, is increasing in curve side, and then you have on the x-axis as someone gets older. So we have scoliosis developing, and then you see this shaded area where the curve rapidly increases. And this is called the peak growth height or peak growth velocity. And this is typically in the first year of puberty, or it's in the onset of puberty. So during this first year, it's when someone grows, and especially in their spinal area, an individual will grow faster than any time in their life outside of when they were an infant, like during the ages of 1 to 4. So this is when people hit that initial growth spurt. And when this happens is when you can have the biggest change in scoliotic curves. And so you can see, you have a normal spine here, and you can see there's a small changing curve. And this can go from a small changing curve over into a really big curve in a very short time frame. This is also why we don't recommend watch and wait as part of scoliosis treatment. Now, you could do observation. Observation is different than watching and waiting. Observation is an active treatment where someone is still actively being evaluated every 3 months. What we see happen a lot of times is someone will be diagnosed with a mild form, or what appears to be a mild form of scoliosis when they're younger. A lot of times by a pediatrician, possibly by a primary care doctor, could be by a chiropractor, another physical therapist, and they're told that it's not that big a deal, it's small, and then nothing is really done. And then a year later, maybe a year and a half later, someone, usually an adult, a parent, will notice there's some really significant changes going on with their child. And then they go back for a follow-up, and they find out that the curve has rapidly progressed in maybe 6 months, maybe a year, but it hasn't been that long, but the curve has changed dramatically. It's because they're going through growth spurts when the spine grows asymmetrical. So when idiopathic scoliosis, there's a lot of different theories, there's hypothesis, but we don't know exactly what triggers scoliosis. We know that there is some genetic factors and probably also some environmental factors that triggers it. But we really understand how scoliosis progresses once it starts. One of the things is there's an initial rotation that develops. And when you start to put pressure on growth plates, it actually stunts the growth. It's called Hoover-Volkmann's principle. So when we get initial rotation in the spine and lateral bending, you have increased pressure on the inside of the spine in both the disc and the vertebrae. And there's actually decreased pressure on the outside. And so you have asymmetrical loading. And that causes the spine to further grow asymmetrical. You get an additional increase in rotation, and you get an additional curve. So when we hit these growth spurts and the body grows very rapidly, you get a very rapid asymmetrical growth of the spine, which is what actually drives the scoliosis. So that's why that's why the International Society on Scoliosis Research, the SRS, Scoliosis Research Society, actually came out, I think it was in 2015, with an official position statement where they recommended that girls be screened at the ages of 10 to 12 because that's generally the area where they have the onset of puberty and we can first detect scoliosis, and boys somewhere between the ages of 13 and 14. So girls twice at 10 and 12, boys between the age of 13 and 14, because we want to be looking for scoliosis during the early onset at the very beginning of puberty, because that's when, if it develops, we need to get on with treatment right away. And when we do treatments like bracing, or in smaller cases, scoliosis specific exercises, we can many times impact how that curve changes over time or how it doesn't change over time. So, what do you look for when someone has scoliosis? So, just a real brief overview. This has been covered in some of the previous posts. Look for obvious symptoms if you're a parent. Look for things like unleveling of a shoulder. If you have one shoulder that's higher than the other, that could be a sign that there is a curve or scoliotic curve developing in the thoracic spine. Look at your child from the side. Look to see if you have a shoulder blade sticking out on one side. Typically, it's going to be the right shoulder blade in the mid back. Look to see, do you notice any obvious curves present? In the low back, do you see any asymmetries, possibly a flattening on one side and an indentation on the other? Typically, this will be a flattening on the left side and an indentation on the right. Do you notice any unleveling of their belt line? Do their pants or shorts look like they're tilted to one side? Do you notice that they appear to have one leg shorter than the other? Just obvious things. When you're looking at the waist to arm, is there a bigger gap between their arm and their waist on one side compared to the other? Look for obvious asymmetries. And then ultimately, you can bring them into someone that's actually trained to do scoliosis. We do free scoliosis screenings in our office. So if you have a child, teenager, adolescent, and a girl should be screened by someone that really knows what to look for between the ages of 10 and 12 years old, and boys, girls at 10 and 12, and boys between the ages of 13 and 14. And when you do that test where you put your hands together and you bend over, they should use something called a scoliometer that we actually use to evaluate rotation in the spine. And if they have a certain amount of rotation, then a lot of times an x-ray is ordered to either rule in or rule out scoliosis. If they have a small curve, the last thing you should do is do nothing. At least do follow-up visits by someone that knows what to look for every 3 visits, minimum every six months, or every 3 months, minimum every 6 months. That way, if you do have a curve, even if it's smaller, if it starts to progress, you can get earlier treatment, because earlier treatment and the right kind of early treatment leads to better overall patient outcomes. So I hope that helps explain why it's during growth spurts that scoliotic curves tend to progress, and when a small curve has the biggest chance of becoming a big curve in a short time frame.